My Lords, the Noble Lady the Minister referred to the government's work developing a reproductive health plan, particularly in the context of what the Noble Lady said was the commitment to safe abortion. I hope the Noble Lady the Minister is aware of the letter that was sent to the DPP by 66 organisations, including the Royal College of Obstetricians and Gynaecologists and Southall Baptistas, which was calling for an end to prosecutions for accessing abortion in the UK. And recent research has demonstrated that over the past 8 years, at least 17 women have been investigated by the police for allegedly ending their own pregnancies under illegal circumstances, although the actual figure is likely to be higher. I note that one of those cases, and I'm sorry, this is very disturbing, there was a 15-year-old who suffered what was seen as an unexplained stillbirth at 28 weeks gestation. This 15-year-old had her phone and laptops confiscated while she was conducting her in the middle of her GCSE exams. She was driven to self-harm, and a coroner eventually concluded that this stillbirth had occurred as a result of natural causes. Can the Noble Lady the Minister tell me that the government is seriously looking at what can be done about not inflicting similar ordeals on girls and women, and whether indeed it's considering the obvious step, which is to decriminalise abortion?
Well, my Lords, I think the decision around prosecutions lies with the Director for Public Prosecutions and their staff. On decriminalising abortion, the government has no plans to do so. But what I can say to the Noble Lady is that we are absolutely committed to ensuring that women can continue to access robust and high-quality abortion services, and also that young women can access sexual health services and other health services to ensure that they get the proper support they need, whatever circumstances they are in, and that they get support and care from the services that they seek to access.
Coming to another issue, I'll begin by welcoming the strong coverage of endometriosis in this strategy. But there is great concern from those who've been campaigning to get better recognition for chronic urinary tract infections. And these get only 2 mentions in the glossary, nothing in the main text. Now, the background to this is chronic rather than recurring urinary tract infections affect women in particular for many months or years. The NHS has only just realised that this condition actually exists, and the term is still not being clinically defined by NICE. Can the Noble Lady the Minister, perhaps, I'm aware this is a fairly detailed area, perhaps come back to me and write to me about what progress is being made on ensuring that the treatment, the full assessment is available to women? Currently, it's only available in a limited number of oversubscribed specialist clinics.
I'd be really happy to come back to the Noble Baroness in writing in detail on the point she raises. It's one I'm aware of, but I can't give her a more detailed answer at this time.